The past couple of weeks have really been a roller coaster. The week prior to opening our ETU, we were working non-stop to make sure that the ETU would be able to operate safely and effectively for patients. And then finally, on our opening day, just as we had gotten everything in place, then we had to switch over into patient care mode. I admitted our first two patients on Monday night after 7 o'clock. It was actually a father and a son, and it was really difficult because the son was very sick. And about 20 minutes after we admitted him, he passed away. After we then had to take care of the father and explain to him that his son had died. He actually said to us that he suspected that that was the case before we even told him. I think he saw the way we pulled his son out of triage very quickly and took him back, and maybe saw in the way we were acting that, that his son had died. So he was not a surprise, and he did thank us for our work. In fact, his wife, the mother of the son, had died a week before, likely from Ebola, and that's where they'd both probably contracted it from. And in fact, the father himself just died a couple nights ago as well. And so both father and son are buried next to each other in our small graveyard here. And I think that was, an incredibly difficult experience. Especially being, the first patient that we admitted to the Ebola treatment unit in our very first hour of operation. But since then, it's actually been quite a mix. We've had 2 other patients die, but we had 2 patients who tested negative for Ebola who were able to discharge, and then 2 other patients who've tested positive who are now recovering and getting better, and that's actually been really heartening to see. So I'm usually an emergency physician. I work at Rhode Island Hospital. I'm on teaching faculty at Brown University in the medical school there. And so most of my time is spent working in an emergency department in a busy trauma center in Providence, Rhode Island. So there are really 3 levels of protection. The first and most obvious is the personal protective equipment that we wear. The goggles and the mask and the hood and the suit and the gloves and the boots. And that can be difficult to put on and even more difficult to take off properly. There's also the protocols that we have, which tell us where we have to wear the PPE and where we don't, and how we act around patients and how we react in this environment. And then finally, there's the training that's necessary to make sure you can apply both the protocols and wear the equipment correctly. And without all of those 3 things in place, you can't be safe. No endeavor is without risk, and there's definitely risk here. But I strongly believe that that risk can be minimized with the proper equipment and the proper training, all of which International Medical Corps is committed to. I think the need here is great. I've never been in a humanitarian emergency with such great need and so few humanitarians. This is one case where really more boots on the ground, more people helping can actually make a huge difference and hopefully stop this epidemic. This is one situation where we really have the chance to solve the problem entirely. I'm really hopeful for the day when we can all celebrate together the end of Ebola in Liberia and have a really incredible party. I'll definitely come back for that.